Afternoon. I'm Sergeant Tracy Garish with the Austin Police Department's Homicide Unit, and that's last name is spelled Gerrish. At this time, the Austin Police Department is currently investigating a series of overdose incidents that resulted in 2 deaths early Friday morning. While the investigations are still ongoing, we're still working to confirm the exact drugs involved. Based on preliminary information, we believe the drug fentanyl may be involved in a few of these incidents. Fentanyl is a synthetic opiate similar to heroin, but much more powerful. It can be in pill, powder, patch, solid, or liquid form, and it can be extremely lethal in very small doses. As I said, investigators are currently working to confirm the drugs involved, the source of those drugs, and any connections between the victims. The community needs to be aware of this public health risk and the dangers associated with the drug fentanyl. At this point, I'm going to turn it over to the EMS commander and let him talk a little bit about the incidents from yesterday morning.
Hello, as we said, my name is Captain Darren Nowak, and that's D-A-R-R-E-N-N-O-A-K with Austin Travis County EMS. As we mentioned, there were a series of incidents that occurred this morning, early this morning in the downtown area from a period of about midnight until 7 a.m. this morning. Austin Travis County EMS responded to 7 incidents in that area. The incidents involved the response of 13 ambulances, 10 command assets. From those incidents, we transported 12 total patients, and we also obtained 2 deceased on scene pronouncements from 2 of the incidents. There were 3 incidents that kind of stand out in particular because they were multi-patient and multi-ambulance responses. The first occurred just after midnight at 7th and Sabine. From that location, we had 1 patient that was transported to the hospital and 1 patient that was that we obtained a deceased on scene pronouncement. The second occurred at 5th and Trinity. That was our largest incident. That comprised of 8 total patients. 6 of those were transported to the hospital. 1 left the scene without any further contact, and we also had another deceased on scene pronouncement from that incident as well. And then the last major or bigger incident that we had was about at 6:19 this morning. It was another multi-patient, 2 patients. One of the patients we transported and we transported both patients from that incident. One of the patients was in cardiac arrest upon our arrival. We performed CPR, and our medics were able to obtain return of spontaneous circulation and pulses, and they were transported to the hospital. Most of these patients that we encountered were exhibiting signs and symptoms of opioid overdoses. But then again, there were some that had other signs and symptoms that were not consistent with opioid overdoses. Currently, our medical office of the chief medical officer is providing a medical advisory to all of our local medical providers, and along with CATRAC, they are providing information regionally as well to provide information concerning the incidents that occurred this morning, and just reiterating the dangers and signs and symptoms and possible patient encounters that they might have if someone has induced this sort of substance. And with